Hi everyone. Good evening, everybody. Yep. Am I visible and audible? Not able to see the live chat. That's why. There are no messages actually on this YouTube chat. That's what I was waiting for. Yep. Okay. Now, good evening. Hi, Doc. Good evening. I hope you are doing good, happy, and not that much stress, which you were like a week ago. Must be happy right now in a good space of mind. You have to be. This is high time. We have been discussing this on and on for months now. Okay, and just, don't write good evening, sir. If you send me smileys, that would do now, for now. Alright, last day of our PERIO revision. Lot of things would have been clear to you by now. Okay, like what you have to give emphasis on. There are two things. Everything is important, which means you cannot leave anything, yet you have to be smart, you have to give importance to few topics a bit more. Okay, you would have known by that. And then it works individually too, which means a topic which we say that it is a bit tough, like bacteriology in plaque or immunology, okay, interleukins and everything. If you are finding it easy, then it's done for you, right? So give more time to that chapter in which you tend to forget things or you get confused very often, okay, or in which chapter the MCQs, after doing twice or thrice, you are still having doubts, okay, like this could be the answer or why this isn't the answer. All right, so you have to make your own path to carve your own destiny. I'll just put smileys, then only you people will say this like this. Okay, I want smiles from you people, no tensions or anything. Okay, this is not the time to be scared or afraid. Gingivectomy, the question that you people ask me from gingivectomy again and again is about Kirkland knives and Orban's knives, Merrifield knives. For the main faciolingual incision, you use Kirkland knives. Orban's or Merrifield are for your uh, interdental incision. And then Orban's is 1 and 2. Merrifield 1 to 4. Okay, but these two serve the same purpose. Alright? Yep, that's good. And I do not know the meaning of this hello over here, this head, this ring, this blue ring. What does it suggest? Because I have never used this emoji or emoticon, whatever you said. Right? So Orban's, Merrifield, they both are for same interdental incision. Kirkland's is the main incision. So please do not get confused in this. In exam, when you have options, you see, okay, you won't find two options which will be the answer. Right? And infrabony pockets, you cannot do gingivectomy. As simple as that. Or what you have to see, less than 3 mm of keratinized gingiva. That is the contraindication. Right? Healing after gingivectomy, immediately what? 3 days, 3 days, 1 month. Gingival sulcus, full epithelialization, and 7 weeks for connective tissue repairs. Okay. For full sulcus to form, it takes 1 month. Connective tissue repair, 7 weeks. Okay. Good evening, doc. I hope you are good. You are doing good. You are studying good. Then electrosurgery, right? Gingivectomy by electrosurgery. Simple. You have to remember the frequency 1.5 to 7.5, and yes, this question can be confusing. Like again, like I said, for many it's in your head from the time you read it first. For few, after even 10 times of revision, the confusion still exists, right? So it works differently for each and everyone. Electrosection, coagulation, desiccation, and fulguration, you have to remember. And these electrodes: single wire electrode, loop electrode, and heavy or bulky electrode, right? These three you have to remember. Depigmentation, not that ENAP developed by US Naval Corps, excisional attachment procedure, we do not use nowadays, right? Simple thing. So gingivectomy, lasers, bone grafts, very, very important, people, very important. You expect, if the question has not been asked last year for bone grafts, expect it to be asked in your exam. Okay. Every alternate year you can find question from bone grafts. GTR, GBR, types of bone grafts. I mean, this is what I can tell. Okay, biomodification. What are biomodification agents? Tonight there are very few good evenings. I mean, very few people are attending IES. Why is it so? Maybe you have done PERIO yourself, which is a good thing, right? But still, do not take anything for granted lightly. Biomodification of root surface. Biomodification is done before placing bone grafts. Please remember the whole sequence as well, because questions can come like that also. What is the sequence? What you will do first, right? For everything you have to stay prepared. If any new question comes, you should not get tensed in the exam. Okay, if you have done it, you will be able to solve, right? And again, do not, you read the question first time. I do not know like how you approach, what is your approach, but what worked for me and what I have been told also on many occasions, like when you have exam paper in front of you, you start solving. You are reading a question, you know the answer, you solve. But after reading it and after going through the options, you are not able to solve, move to the next one. Still not able to solve, move to another one. But do not stay stuck on one question, right? Because you do not have even 60 seconds per question, right? So you have to move fast. Once you have done like many questions, then you will gain confidence. You'll get warmed up and your mind will start working a lot better. Okay, and at times what happens, there is a question, you are not able to recall its answer, right? So in that case, if you put stress on your mind, it will you will not be able to recall it. Okay, maybe you have spent 60-90 seconds and you are not able to recall. So do not waste those 60-90 seconds. You saw the question, you are not able to recall, move ahead, because it's there. The answer is there in your subconscious mind if you have studied it. And suddenly, आपकी घंटी बजेगी दिमाग की, and you will recall it. Okay? So you have to do like this. Do not waste time on remembering something. A value, like what is the value of attached gingiva in maxillary incisors? It is 3.5 to 4.5 or 3.3 to 3.9. You are not able to recall. You are getting a bit confused. You are tensed. Do not waste time. Move ahead. Because in a Ziffy, you will remember. You will recall that yes, this is the value. I know it. Okay. So that way you have to do. Biomodification of root surface agents. Everything you have to do, right? Membranes, which is a non-resorbable membrane, which is a resorbable membranes. And same goes for sutures. which is a resorbable suture, which is a non-resorbable suture. Now this is a simple question, a basic question. Okay, so you must know it. This is a straightforward question. They cannot twist your mind into it. Either you know it or you don't know it. Then bone grafts, everything on bone grafts. What is autograft, what is iso, allo, hetero, xeno, and osteogenic, osteoconductive, osteoinductive. Bone morphogenic proteins, BMPs, are important. Then all the intraoral grafts, right? What is the difference between osseous coagulum and bone blend? Important, right? Everything is important in this. Guys, whenever you have doubts, please keep on asking me. I am seeing that many of you have asked me questions and many are yet to ask me questions. I'm trying to solve then and there, and I'm planning to have live sessions also of your doubts, right? You people will send me questions and in the next day we will solve them live, okay, so that you will able to know how to approach that question, particular question, right? Grafts, iliac crest graft, please do not waste too much of time on from which aspect it is taken, because if you will ask your oral surgeon, they will give you a different answer. From general surgeon, they will give a different answer. Okay, it has been like this forever. Then allografts, everything, urist, particle size is important. What is FDBA, what is DFDBA? Very, very important. Read it. I have told you in the class, difference between osseous coagulum and bone blend. Very important question this is, dog. You must be knowing it. I am not discouraging you. I am just trying to make you alert. Okay, the difference lies in terms of its structure. Okay, whether it is cortical or it is cancellous or cortico-cancellous. Then in the particle size also there is this difference. Okay, I am not telling you directly. I am just trying to make you reach there to the answer. Right? Because what happens now? If I tell you, you won't be able to remember. Just after the class is over, I mean this session is over, turn your pages, notes and Carenza. It will take 60-70 seconds. Right now, waste 60-70 seconds to find out. Or even 2 minutes, say 120 seconds. You will be able to know, and then it will stay in your photographic memory. That yes, I had studied on that particular page. Okay, that is important. Osseous coagulum, bone blend, maxillary tuberosity, everything. I mean bone marrow transplant, every graft you have to see. FDBA, DFDBA, then xenograft, right? You were thinking the sir would have told me the answer rather than all his pravachan and this chit chat. No guys, I'm doing what is best for you. You will say, you can abuse me right now, but once you are out of the exam hall, you will thank me for this thing. Okay, once do the hard work yourself, just once. Even then you are not able to, you tell me in a message, WhatsApp message, Telegram, wherever. Sir, I searched, I couldn't find, or I found it but I'm not able to understand. Then I'll tell you. When you tell, sir, I tried but I couldn't get, you have to try it first. Okay, then alloplast. Alloplast means artificials. Okay, so you have to do this. All the bone grafts, guys, I have told you this 4 or 5 times in last few minutes that they are very, very important topic. Bone grafts, right? Calcium phosphate graft is very, very important. What is hydroxyapatite? What is beta TCP? What is the ratio? Which of these is resorbable? Which of these is non-resorbable? Okay. Piezo surgery. For piezo surgery, I guess in your WhatsApp groups, I have sent you few tables. If you guys still have doubt in that, you tell me, I will send you that again, a video or something on piezo surgery. You expect a question to be asked from piezo surgery too. Then this, it is not as important as we compare it to bone grafts or regenerative surgery, but still resective osseous surgery is important, doc. Dr. Khushi, was it, I mean, will you search it? Will you search it yourself and then message me that yes sir, I searched, I either got the answer or didn't get the answer. Then I will be explaining you. Okay, you have to do the effort once from your side. Okay, because this question right now is, this should raise alarms in your head. You asking what is the difference between osseous coagulum and bone blend, right? Because bone grafts is amongst the top 10 topics of periodontics. So everything about them you must be remembering right now. Okay. What is additive surgery? What is subtractive surgery? Subtractive surgery is your resective osseous surgery, right? What is osteoplasty? What is ostectomy? What you use for doing osteoplasty and what you use for doing ostectomy? Power instruments or hand instruments, right? You have to remember them. And then these like Osken back or Osken bean chisel, Rhodes chisel, Goldman Fox chisel. All these names you have to see. Sugarman, Schluger. These are files. Okay. These you have to do, please. And then the procedures. Vertical grooving, radicular blending, fettling interproximal bone, gradualizing marginal bone. Right? Important. When you can do resective osseous surgery, when you cannot do resective osseous surgery. This also is very, very important. Simple thing, guys. Just remember the concept. Okay, what concept? Resective osseous surgery means you are removing the bone. So if bone is already less, then you will not do resective osseous surgery because it will make the bone further weak. Okay, so just in mild to moderate bony lesions like 1 to 3 to 4 mm cases, you will do resective osseous surgery. You will not do resective osseous surgery when bone loss is more than 5 mm. Okay, so these are the things which you must be able to do. Then guys, this wall defects is very, very important. What is one wall, what is two wall, what is three wall, and what is zero wall defect. Okay, what is zero wall defect? That also. Right? You guys are asking me again and again what is in aggressive periodontitis, long and narrow defects. Okay. Combined osseous defect. Images on WhatsApp I will send you if you ask me again. There is an image, or I guess I would have sent you in the WhatsApp groups. Okay. Where there is 3 wall, 2 wall, 1 wall and combined osseous defect also is there. Right. So please, all these defects, host modulation, simple, not very difficult topic as such. You can easily do it. All the drugs you have to remember. Okay. From host modulation, what can be asked the most? Tell me. Write in this chat. What is important in host modulation? What could be asked? What has the maximum chances of being asked in host modulation? Speak up, speak up, speak up. Surgical parts expected question. Once I just told you, no? Bone grafts. 1. Okay, and I'm asking you this. You tell me, doc. On host modulation, which is the most important question that could be asked? This is the one. SDD. Submicrobial dose of doxycycline. What is it is called as? It is called as periostat. Okay. Yeah, doxycycline. Good. So that is very, very important. All NSAIDs के साथ में क्या होता है? Rebound phenomena. When you, yes, periostat. When you stop giving NSAIDs, then the disease comes back with more vigor, right? NSAIDs show rebound phenomena. Like these type of questions are those which you tend to miss. Okay, concepts you tend to miss. And then in exam, you may feel like, okay, I mean, two or three, you will have doubts. And please remember interleukins, cytokines, prostaglandin, TNF alpha. What interleukins are pro-inflammatory and what are anti-inflammatory. Okay, this you have to remember. Surgical parts, guys, you were saying, I'll come to that. Lasers again are important. Wavelengths of all the lasers, right? Argon, diode, NDYX, CO2, erbium, chromium, all the lasers. These are the hard tissue lasers. Okay, all the lasers. And in lasers, one thing you please do: penetration. Which layer can penetrate tissues to which level? That also you have to do. Alright? Loops, I mean, these are the questions which do not hold too much of importance in terms of chances, but yes, anything can be asked. Types of loops and their magnification. Okay? Loops and their magnifications, advantages of microsurgery, knots, types of knots in microsurgery. Important, right? You were asking surgical parts expected questions. I said sutures. Okay, sutures are important. Resorbable sutures, non-resorbable sutures, suturing techniques very important. Periodontal flap and mucogingival surgery. These two chapters are the most important, people, most important. Okay. Instruments can be asked from flap, types of flap. Which flap is used in aesthetic areas? What is the advantage of which flap? I mean, particular flap and the disadvantage of a particular flap. All those things you have to do. Okay, what is a papilla preservation flap? What is a conventional flap? When are vertical incisions given and what should be the location of vertical incision? Right? What are the types of horizontal incisions? What is an internal bevel incision? What is a clavicular incision? What are the other names of clavicular incisions? Right? All the incisions. These are the questions, Dr. Rohan, you are asking. No, these are the questions which are important from surgical topics. Okay, why do you give vertical incision? What is modified Wiedemann flap? Okay, what is modified Wiedemann flap? What is undisplaced flap? And what is apically displaced flap? What is a distal wedge procedure or a distal molar flap? What is the significance of each type of flap? What is the usage of each type of flap? On this questions are asked. What do you achieve with apically displaced flap? Suturing, like I was saying, suturing. Images of suturing important. Suturing techniques. Suturing materials. Hey, don't thank me, Doc. It's my duty to help you guys, right? It's my duty. If I'm not doing it perfectly, then I'm at fault. Else, it's my job to do it. Okay. Suture materials. All the sutures materials, suturing techniques. Right? Figure of 8. Sling sutures, mattress sutures, anchor suture, periosteal sutures. Their images you have to do. And healing, I was telling, healing. After gingivectomy, healing after scaling, healing after curettage, healing after flap surgery. Okay. And then periodontal pack, an important topic. Periodontal pack. Why do you give periodontal plaque? How many days after you have to remove? Contents of this co-pack. Okay, contents of co-pack. Simple question will be asked. Simple. Tonight we will get free early. Okay. Then you can save that time. Mucogingival surgery, people. Very important topic. Very, very important. Right? Biological width. Crown lengthening. Okay. And recession coverage is the major one topic. Right? All the gingival augmentation techniques. Gingival augmentation, apical to recession, gingival augmentation, coronal to recession. Right? Semilunar flap and other techniques. What are all the techniques? Biolaminar technique. Then lateral pedicel flap, pouch and tunnel technique. Okay. Everything. Coronally displaced flap, laterally displaced flap, FGG, CTG. Please keep your concepts clear, and they should be clear by now of this chapter. Mucogingival surgery, right? You should not have any doubt why to use connective tissue graft, when to use free gingival graft. Okay. When you need full thickness flap, when do you need partial thickness flap? Everything is important. Everything I have told you. Indications of each flap. Which technique shows creeping reattachment? I am asking you, which technique, which recession coverage technique shows creeping reattachment? Biological width, crown lengthening, frenectomy, frenotomy. Creeping reattachment, how many remember? Okay. Your last topic is, guys, in this is about implants, right? So from implants, everything, I mean, implants are covered in 3 subjects: oral surgery, prosthodontics, and periodontics. Peri-implantitis is a very small part of implantology. How do you place implants? Everything, implant related complications, and in which people you will good guys. Okay, everything in implants you have to see the components. Okay, I mean, I'll just because this is what I guess you people should okay, things like these. This is what healing cap. Okay, things like these will be asked to you. Okay, what is a healing cap? What is a cover screw? What is a hex drive? What is an open tray impression technique? I mean, that is prosthodontics. Okay, but then about surgery, what are the types of bone? D1, D2, D3, D4. Okay, how much should be the distance between two implants? Or how much is the distance of implant from a natural tooth? Okay, all those things are important in implants. What are the complications which are related with implants after placements of implants? What could be the contraindication for implants? What are the relative contraindications? Okay, so these are the things, people, which you have to do in periodontics. Now, I'm I'm suggesting you something. I mean, I want you people to be there, like whoever has attended my lectures, each and every one of you. Uh, we can start this tomorrow or day after. I'll give you 2 3 days for this. Then what do you do? Like you are solving in PERIO. You can segregate in 35 40 chapters. How, I mean, whatever chapters are there. Then I want to take 5 hours of yours, or you can say like in 5 sessions, and a session can go from 1 hour to 1.5 hours max. It won't go beyond that. We will select few topics. Like for day one, topics are like anatomy, stages of gingival inflammation, gingivitis, defense mechanism of the gingiva, pocket, TFO. Okay, 7 8 chapters. So in one day, you will send me your doubts from these 7 8 chapters only. Okay, like today is what, 11th Feb. No, I'm just giving you an example. From 12th Feb, 12 a.m. to 12 a.m., right? From midnight to midnight. Before the date changes, 7 8. I'm just giving an example of 12th Feb. I mean, it could be any date. You send me your doubts in group in my WhatsApp, anyways, and I'll collect all those questions. Okay, and I want to know what kind of problems you people are facing and what's going on in your head in that particular topic. Your doubts will help me understand that. Okay, so in that, I don't think like in 7 8 chapters you will have more than 40 doubts. It won't be more than 40. And for solving 40 doubts, 1 hour is max. Okay, I won't be telling you only the answer. I will be telling you the explanation also. Okay, so that ways good amount of your revision will be done. Okay, days we can decide later on. You still have say 35 36 days remaining. Okay, and what I'm suggesting is, it's not like that on that whole day you are doing those 7 8 perio chapters only. Rest you're not doing. No. Doing 7 8 chapters MCQs will require not more than an hour for you people. If you are revising now, if your whole course is done, so then just 1 hour to this, and then next day I'll take 1 hour of yours, so that in 5 to 6 hours all of your perio doubts will be solved, or you can say your perio will be done every way. Because you have one doubt, like Dr. Rohan has some doubt, while Dr. Piyush has some other doubt. But when I'm telling you, you will get to know that, plus who knows, few extra things you may get to learn. I mean, I'm just suggesting we may work on it, and anything you people want to ask me, you can ask, and I'm suggesting you guys to do as many MCQs as possible right now. Papers, I'm thinking which we had seen this we had seen. This I'll see. This also I guess we had done. And this, yep. Last 3 years papers we have seen. Right? Drug-induced enlargement is there. We have seen drug-induced enlargement. Okay. Bacteria. Again, today I got question from one of you people about Tenerella. Okay. Tenerella. You people asked me about what is Tenerella. You people were having doubt in what is capnocytophaga. Okay, so these are the topics, that flow chart of what bacteria comes in which complex. This should be on your tips. What all come in red complex, what are in green, what are in orange, what is yellow complex, what is purple complex, everything. Streptococcus constellatus. You shouldn't be asking me this now. Okay, sir, why is this not in yellow complex? Right? This you all should be knowing. Alright? Yeah, concept based questions I can forgive you for, that you are not able to solve, you need my help. But something which is basic, which is about learning the chapter, that you should not forget. Okay? Because by now, I mean, okay, I'm asking you one question, each and everyone, and you have to reply. How many of you have not done revision even once? I'm asking about PERIO only. Like even one time you have not been able to solve the MCQs completely. Or how many revisions you have done? Each and every one of you. Would you consider interdental area in keratinized gingiva? Yes, of course, dog. The central part is made up of attached gingiva, which is keratinized. The margins are non-keratinized only. But tell me, how many of you have not started with revision yet? Because that is important, people. As many revisions you can do, you have to do at least 2 revisions of each and every subject. Because what revisions do, it helps you in shrinking the syllabus. Okay? And you will be able to recall easily. Few things which I remember, which I have to tell you. One is about that thing, eruption, and what happens to that recession thing. Okay, gingiva. Recession plus attached gingiva. No one wants to put their cards on the table, whether you have done revision or not. Okay, I respect that also, no issues. 2 times revision done. Very good, doc. Really, really very good. Which means if you have done revision 2 times, if you are going to do the revision for the 3rd time, your time taken from the first revision, for 3rd time it should be 25 to 30%. Just that 3 revision, good. Now people, I was telling you on day 1 that you can lie to each and everyone but yourself. Okay? You cannot lie to yourself. So you have to make sure that all your revisions are fruitful. By fruitful, what is the meaning? your doubts should have reduced, and the amount of material that you retain in your head would have increased by manifold. So need revision of image based questions. Okay, I'll take once images also. One day I'll put different, because right now if I put those images, it will not be good, because it will be written over there. I'll put a slideshow and then I'll ask you. Okay, that will be better. One day I'll put many images and then I'll ask you that revision of image based. But what I'm saying is, like anatomy chapter, bone grafts, mucogingival surgery, instruments, plaque, calculus, right? These are the chapters which you would have revised at least 3 to 4 times before going into the exam. Because when you revise them, then only you will get to know your mistakes or what you are forgetting again and again. And then one advantage of doing multiple revisions is something may get stuck in your head. By stuck I mean which you are not able to crack. Suddenly it could get cracked. It happens, right? You might be getting confused in modified Wiedemann flap, undisplaced flap and apically displaced flap. When you are reading, you will feel like, okay, now I understand it. But after 20 days, if that same thing appears in front of you, you'll think like you have never studied it. Okay, it can happen. So then what? So when you read that thing again and again, one time it will click in your head. That happens. Okay, with lot of things. And guys, PERIO is an easy subject, very simple subject, small subject. In PERIO, we expect you to get 100% marks, and it happens every year. People have 100% track record in PERIO. Okay, in oral medicine, you may do mistakes, or in medical topics, but ma'am is taking care and I know she is putting all the hard work. So rest is in your hands. For PERIO, I can say, guys, and you did not tell me, I mean, you did not express your thoughts on it. I was, the way I was saying, few chapters in one day, then few in the other one. That ways we can do, and it will be easy. You people, and if in one day I have like from every chapter, if you are sending me doubts, then it will not be easy for me to segregate. But like from 5 chapters you have sent me doubts, it will be easy for me to teach you. Apart from image based questions revision, anything else that you want to add in that? Any other thing that you people want? And we will be doing that revision on the app. Questions we are going to do now. Okay, questions after questions. As many questions as possible. GCF, simple topic. Saliva, simple topic. Please do not have doubts in these type of chapters. Treatment plan, diagnosis, prognosis, levels of significance, all these chapters, small chapters, tricky chapters. Okay, they are tricky chapters. Please do their questions carefully. They are not very important chapters, but one incorrect questions can make a lot of difference in your lives, people. From branch of your choice and college of your choice to any branch, any college, to not getting a seat altogether. Okay, that difference could be made by one mistake. Okay, so you people cannot afford mistakes. People not even writing anything now, because all the topics and all I have told you that yes, this way you have to revise them and everything. But now, what do you want me to do in next how many days? 35 days which are remaining. Which way you people want me to go for you? I mean, I'm ready to help you each and every way. MCQs, theory part, because I'm writing it, I'm maintaining a note in which I'm writing all your queries and doubts, like theory wise also. Yes, sir. And which college you people want to go to? Image based, yeah, we'll do image based. Any like in next week we will be doing image based. One day I'll simple that will be important questions sirs compiled from all the chapters. Okay. You want me to compile or what? Yeah, doubt clearing sessions will be helpful. Yes, I know, man. I know, I understand. I am like you only. Most important, see, like this type of question is mm, vitality test could be there, okay, which can tell you vitality is important. But again, this type of question is like it's clinical condition based. Okay, what the patient presents with. Nature of pain could be one. Probing is an important one, very important one result of probing. Okay. Vitality, probing, those are important, the most important criteria. Right? Because you have to see from both the point of views, from perio point of view as well as endo point of view also, this particular question. Doubt clearing sessions we are going to take. And I am you people, it's not that, I mean, it has been like more than a decade when I had sat in an exam. But yes, I still, yeah, in this, it should be result of probing. In this, it should be result of probing, right? Exudate can never be important. Intensity of pain. Pocket, you won't have pocket in periapical abscess. No, a big pocket won't be there. Study periapical abscess once and then come back to me. Okay? You have to study periapical abscess once from endodontics and then you come back. Right? A periodontal abscess will give you different results on probing. A periapical abscess will give you totally different. That is why probing is important. what I was saying is, it still feels like I appeared in the exam yesterday, and like, I mean, times were different. 2011 was a totally different time, and see, for each one of you, the family conditions will be different. You might be the elder sibling, you might be the younger sibling, uh, you might have things like have to take responsibility of that family. And sir, in that, intensity of pain can also be the answer. Not really. I mean, probing will always be above pain. Okay. Intensity of pain is a very subjective sort of thing, right? So what I was telling you that, so for everyone, exam matters something else, right? You have to just get selected. That is important, and that's why you are appearing in it. I feel this, right? If we are having this YouTube live session, then it's, I mean, you could be doing something else in your life which would be much more interesting than this, right? Not preparing for NEET. But why are you preparing? Because once you have done BDS, you are a dentist. So if you want to excel as a dentist, if you want to move ahead in this profession, that yes, you should be an MDS, and MDS from a government college is the best thing. That's why you are here right now. Now, to be an MDS from government college is not easy. We are trying to make it easy for you. And lastly, it depends on you. How dearly, how desperately do you want it? And what length you can go to achieve your goal, whether it is just your goal, is your dream, or anything, right? You still have 35 days. Lot can be done in these 35 days. Okay? If you are feeling like, if any one of you is feeling like, this year my preparation is not complete, I will just appear, I will gain experience, and I will prepare wholeheartedly the next year. Why I'm saying this? Because I get to know this from your people, and this used to happen with few of my friends or juniors while I was preparing, okay, and while I was doing PG also. So when you are saying that thing, no, you are either trying to fool yourself. Which way? When you say that this year my preparation is not complete, next year I'll be able to. No. Next year कुछ नहीं होता, जो भी है अभी है, right? You have to live in that moment, live in that year, right? So today, it's not like tomorrow is the exam and now you think that now in these 24 hours I'll do everything. No. But yes, 35 days are still a lot, right? If you are doing 200 questions every day, 200 MCQs every day, in 35 days, you will be able to do 7,000 MCQs. 7,000 MCQs. That are a lot, right? See how much exposure you will get with 7,000 MCQs. I'm just giving you a random number. It could go up to 300 too. Okay? For people like who have done revision 3 times. And one more thing you can do, what you will do, like you see, just this. Localized aggressive periodontitis caused chiefly by. You have a question in front of you. Now this is like I'm asking you A for apple or A for ball. Okay, it's that kind of question. You know that A is the answer. But what is this? What is this? And what is this? If you know about them, then your preparation is solid. And if you know more about this bacteria, then your preparation is solid. Okay. So by now, you must know in your book where you will find about AA, or in your notes, whether, I do not know how many of you use sticky notes, but they are a lot of help. You prepare like sticky notes, small, 5-6 points which are important, you write here and you keep it pasted, And then so that you do not have to turn pages and book or everything like that. Okay, that ways it can help. I mean, I'm suggesting you a way. I'm not saying you have to do it, or if you're not doing, then you are in you won't make it. No, it's not like that. For everyone, the method, the formula differs, right? So do it like Marin's classification, class B. It may be possible that you remember class B, but you do not remember class A and class C. So you have to see all the options, and when it is asked about class B, you recall what is class A and what is class C also. So that in exam, what if class A is asked, or from this some other thing is asked, you must be able to solve it. You are prepared completely. Okay, so in your revision, it is important that when you are doing a particular question, everything surrounding that question must be clear to you. Am I making some sense right now? Am I making some sense, guys? Wait. This. I'm telling you how do you solve it, okay? एक तो समझ में नहीं आता तुम लोग यस सर किसके लिए बोल रहे होते हो. See this. Can you see on your screen? Is this clear? Antibiotics are effective in the treatment of patients with NUG. Patients with moderate or severe NUG and local lymphadenopathy or other systemic signs or symptoms are placed on an antibiotic regimen 500 milligram orally 6 hours for 10 days. Okay, 500 milligram orally every 6 hours for 10 days. For amoxicillin sensitive patients, other antibiotics are prescribed. Okay, erythromycin 500 milligram 6 hours, metronidazole 500 milligram twice daily for 7 days. Antibiotics are not recommended for patients who do not have systemic complications. Okay, so this solves it forever, right? And then what I was telling you, these mouthwashes also, equal mixture of 3% hydrogen peroxide and warm water every 2 hours and 0.12% chlorhexidine twice daily. Right, guys? That's why I'm saying you again and again that please read it once. Because when you read it once, it will stay in your head much more. Okay, that photographic memory works. And photographic memory is accurate. It cannot lie. What you have seen, it stays. Right? Right, guys? So on this note, I will say good night to you. I have, in these 3 sessions, we have seen all the chapters, what all is important, how to approach. Now it's time to do the questions, all the questions in PERIO. and we will discuss in groups. We will discuss like how many chapters we will club in one day, and which day we will decide particular days where we will be doing the stuff. Okay, the revision we will be doing. Doubts, basically now it will be time for the doubts, for MCQ related doubts, and I will be telling you extra points also. Okay, प्लीज बस जान लगा दो यार सब लोग, सिलेक्शन निकाल लो, डू इट, देयर विल नॉट बी एनी नेक्स्ट टाइम. ओके, बार बार तैयारी करना इज नॉट ईजी, इट्स नॉट ईजी टू प्रिपेयर अगेन एंड अगेन. ऑलराइट, इट्स नॉट ईजी एट ऑल. सो जो भी है यही है, अभी है, दिस ईयर. ओके, 18 March 24 should be the end of it. Crack it forever. All right, you still have time, you can do, because people before you have done, people every year will do. I mean, whoever are attending this live session, I know many of you are here who might not be thinking that yes, you have that selection material in you, but in these 35 days, on the day of exam, you will have that confidence that yes, I have it in me, and you will crack it. It happens, and this is no miracle, nothing. It's just simple hard work, persistent perseverance. Okay, just fight it out, stay there, keep fighting, and keep your energy up, keep your spirits up. Talk to people who are good, who are your well-wishers, who talk good, who can make you light, who can cheer you up. Okay, do not have any negativity around you, and I am there for you always whenever you have doubts. And these days also, I am trying to solve each and every doubts that come my way. Just that I have two small kids, so at times you people many might think that sir has just seen my doubt, there is a blue tick, but he is not answering. What happens, guys? What, like, I'm telling, and then one of my two kids, one of my two twins, they start crying. My wife says, just please Sagar, isko tum dekh lo 5 minutes. So I would have seen, my mobile might be in my hand, but I'm just taking care of my baby, like that. And when, I mean, then it may slip out of my head, or few other questions have popped up, but I will be answering for you for sure. So you can wait for 5 or 6 hours for a question to be answered, and then you please ask again, sir, you have not answered yet. Again 6 hours may pass, you can ask again. Please, this you have to do. This I request you people. You have to ask me again and again, but I will, it's not like you have to ask me 4 times only, then I'll answer. Most of the times I'm answering in the first time itself, right? Because till exam, I want to be available to you as much as possible. Good night, guys. Study well, sleep well every day, eat well, stay healthy, stay happy. Okay? Just karna hai, right? Bye, guys. Good night. Good night, everyone. I'm switching off the feed now.